thank you all for joining us. We are recording this, so anyone who wasn't able to join us today will be able to listen to the recording. I think we wanted to start out just by introducing some of the nursing and allied health leadership team that's here today. And then we have a smaller group, so we could probably, all introduce ourselves, kind of where we're from and where we work. So I'll start. My name is Brittany Coons. I am on the Nursing and Allied Health Leadership Team. I represent the Early Career and Trainee Committee. So for those who are kind of not familiar with how the leadership committee works, each of us serve one of the IDNs. So the heart IDN, the lung IDN, MCS, and then PVD. And then we have 2 members who are members at large. And then we have one who serves the Early Career and Trainee Committee. That's what I do. Each of us serve 3-year terms. And I think part of our agenda today is going to be talking about 2 upcoming positions that are going to be filled for the upcoming year. So that's a little bit kind of about our the leadership committee. We're also joined today by Dr. Christian Benden, who's our president-elect. And if you want to say a few words or anything.
Yes, thank you so much for having me. I think last time I joined your group, I think it was actually in person in Denver, which was much more exciting because A, it was a larger group, and B, it was in person, and C, there was some lovely food and wine, I think, served. So from that point of view, this is a bit dry. It's I think it's around 9 p.m. Zurich time. So it's evening, so the end of a long working day. So but I'm happy to be here and to answer questions you have. Going with you through the agenda. I mean, as you said, we're a small group, which we've also seen with the other like town hall meetings, and probably it's something we could talk about as well. And we got some ideas, so I'm happy to share that with you. All right.
Great. Well, thanks for joining us. I'll kick it over to Colleen then to introduce herself.
Great. Thanks, Brittany. And welcome to everybody who has joined. My name is Colleen McElligott, and I am a nurse practitioner and researcher at the University of Colorado. I have been a part of the leadership committee for the last 4 years, I believe, but I serve as the MCS IDN liaison, and that position is going to be open with the upcoming cycle. So had some great applications and encourage, I think part of this is hopefully to get people more aware of the opportunities and volunteer initiatives that are taking place within ISHLT, and so that our professional community does have a voice at the table in any of the IDNs and any of the committees. So really appreciate you joining, and also feel free to interrupt with any questions or stick a question in the chat, and we'd love to hear from you throughout as we go through some updates, and then hopefully generate some discussion around upcoming webinars and things that are going on within our professional community.
Great. Thanks, Colleen. Christiane, you want to say a few words?
Sure. Welcome, everybody. It's evening for me as well. So greetings from Europe, from Germany. I am employed at the Freiburg University, and my position with ISHLT currently is to support the Leadership Advisory Forum, which is a group to support the board of directors, and it's coincidence we will meet tomorrow night again.
Great. And I guess I should say kind of a little bit about what my background is, besides the fact that I just represent early career. But so I'm an assistant professor at Villanova University, which is a university right outside of Philadelphia. And then I work clinically as a clinical nurse. Someone's mowing the lawn right outside. In a cardiothoracic surgical ICU. So that's a little bit about my background. But we have a smaller group, so why don't we take some time to introduce ourselves, maybe just say kind of, where you're from and what area you work in or what your position is like. If anyone wants to kind of jump in, or I can call on you. Feel free to unmute yourself.
I'll start. My name is Monica Nabel. I'm one of the post-heart transplant nurse coordinators at Inova Fairfax in Virginia. So I'm excited to be here. I was I'm a new member of ISHLT. I went to Denver and then I went to Boston last year. So I'm new to the transplant community. So I was a CVICU nurse and then switched over to transplant in 2020.
Great. Well, welcome. So do you know Meg Ferguso is our chair of the Nursing and Allied Health Leadership Committee here. She's not able to make it because she's in the middle of a move and she is in flight. So she is sorry that she can't make it. She was really hoping she would.
I know her office is actually right next door to mine.
Oh, there you go. Okay, nice. Well, welcome. We're happy to have you. Who wants to go next and introduce themselves?
I can go next. Hi, Brittany. Hi, everyone. So many of you know me. I am Karen Birch. I am working at Dell Children's Hospital in Austin, Texas now. I just recently moved here from Stanford Children's, and I'm also on the board of directors with Christian Benden. So glad to see you all here.
Thanks. Great to have you here. Who wants to go next?
I can go next, Brittany. I'm Angie Valeka. I am the clinical operations manager for the heart and lung transplant program here at Cedars-Sinai. Have been involved with ISHLT for a very long time. Don't want to say how long, and have served in various positions. But it's always nice to chat with you all and see everyone. So nice to be here.
Thanks, Angie. Great to see you. You know, some people are on their phone, and some people might not be able to speak, and that's fine. But anyone else want to introduce themselves?
I'll go. My name is Sue. I actually work with both Monica and Meg. I'm also part of Inova. I'm specifically on the heart transplant team, where I actually recently moved to the post-heart transplant side. But even before then, I did pre-heart, and then I actually also have a little bit of experience working with kidney transplantation. But I am still considered an early career member and actually just went to ISHLT for the first time this past year in Denver, so very, very new to this world. And then prior to sort of, doing transplant, I was also a bedside adult ICU nurse.
Great, welcome. We're happy to have you. Looks like we have two other people, but I'm not sure if they're able to speak. If you can, there you go.
I'm Kate Hughes. I'm currently an inpatient nurse practitioner at Vanderbilt University for lung transplant. And we also take care of the advanced pulmonary hypertension team, our patients inpatient. I'm an early career as well. I've been at ISHLT 3 years, into my fourth and just trying to get more involved. So this is my first meeting joining in live.
Welcome, happy to have you. Okay, got it. Fireflies is Juliet. Juliet, do you want to introduce yourself?
Hello, everyone. I am Juliana Sazeminde. I'm the Governance and Communities Administrator, and welcome. Thank you for coming.
Great. Okay, so we'll move on to our agenda, just a few updates, and then we kind of wanted to have some time for discussion about a few things. So the first few things we wanted to update you on was the Symposia proposal update for the 2024 annual meeting. So there were 195 proposals submitted this year, which is a new record high. And what that's the program planning committee is now working to develop which proposals will make it to the annual meeting. So that will end up being about 46 symposiums. There'll be 46 75-minute symposia that will be at Prague. So Prague is where our annual meeting is this year. It's going to be held April 10th to the 13th. Hope that most of you can make it. So by October 9th, if you've submitted a symposium proposal, you'll be notified of the outcome of whether that was accepted or partly accepted or has been rejected. So you'll kind of get some communication by then. we just wanted to put a plug in to start thinking about next year. We always start thinking very early about the following year for 2025 because it sneaks up so early. So Symposia are basically developing sessions, coming up with a topic and then coming up with different talks that you would want around that topic, and then also proposing speakers. So it's not submitting abstracts like we'll be doing in October. It's kind of coming up with these ideas of what you want to see being talked about at the conference, a certain focus area, and then kind of coming up with what are the different talks you want seen people to give around that area. So start thinking about that now, and especially as you're at the conference, about what are the things that you feel like are missing, what are we not talking about at the conference, what are you maybe seeing in the literature that you're not seeing webinars on, or just kind of the missing areas. And in June is usually when it opens up for you to start developing symposium and to submit them. That's usually the deadline for it. Sometime in the spring, what we've done in the past is hold symposia workshops for nursing and allied health. So if you have an idea, but you just don't know how to like get it together and put a symposia together, what we're going to try to do is meet as a group and discuss those ideas and maybe try to come up with some teams who can work on ideas together. So that way you don't feel like you're doing it by yourself, or it's just better to do as a team. So start thinking about maybe some of those topics that you would potentially want to submit, especially at the annual meeting. It's a great time to start networking then and identify maybe who you can work with. And then we're also here to help facilitate that process. So just wanted to put a plug in. I know it's really early, but as you're going throughout the year, if you're seeing things in practice or reading about things that are really interesting, just jot them down, and then we'll discuss them in the spring. Second update, kind of going along with that, you may have seen in ISHLT Connect, I had sent out on behalf of the leadership team, a database, a nursing and allied health survey that we've done for the first time. And that really is to help us understand who the members are, what your background is, and what your interests are. And this really helps those who are serving on program planning committee. As we're going through these symposia and we're trying to get nursing and allied health to be represented on different sessions. When they need a certain talk, someone can talk about quality of life and lung transplant, for example, we can go to this database and look, okay, who has identified that they have expertise in that area and wants to be involved. And that's an opportunity for us to get you more engaged. So if you haven't filled out that survey yet, it's on ISHLT Connect. And I wanted to take just a few minutes to kind of go over what the results of what we have so far. So we have about, I think, 250 nursing and allied health members in our professional community. And we got about 52 responses. So that's about a 20% response rate. Let's see if I can bring up my 120,000 things I have up here. I want to say it was this one. Nope, not that one. Here we go. So we had, like I said, 52 responses. 94% of the people who responded were female. We have asked people, what their profession is, and about 42% said they were nurses, 40% were advanced practice providers, and 7% were program coordinators. And then you see a few others like physical therapists and nutrition, psychiatry. So that's kind of the composition of the 52 people who had responded. Here's a breakdown of people's backgrounds. So we had about 70% were from the heart IDN or worked in heart area, 38% were lung, 60% were MCS, and then about 5% were PVD. Most people are working with adults, some are pediatrics, and some are working with both. And then here's kind of really where we were interested to see what are people's interest areas. And so you can see a lot of people interested in quality of life, in symptoms, in kind of these psychosocial topics, in social support and caregiving. We've included social determinants of health. Palliative care was fairly popular, looking at issues of adherence in these populations, and medical management. So this is kind of the area of expertise and interest of the nursing and allied health group among those who have responded. So this is something that we're going to try to send out yearly, so that you can update it. That way we just have an updated list of the nursing and allied health PC and kind of what your areas of interest are. This will also help us guide what sort of webinars we're going to plan for the year so that we can make sure that we're aligning the opportunities that we're presenting in webinars with the interests of the nursing and allied health. So if you haven't filled this out, it's within ICHLT Connect, and you can see the link there. And I encourage you to do that. Let's see if there was anything else on my list before I kick it over to Colleen. There we go. Okay, yes, one more thing about the annual meeting. So abstract submissions, I think it is open now. I think it opened up on August 1st if you want to submit a research abstract, and that will close on October 17th. Some key takeaways that we just wanted to highlight is the kind of the areas that you want to propose in your abstract are as the website says, if you go to the link for abstract submissions, it will indicate including the purpose, the methods, the results, and the conclusion. Just being cognizant that there is a 22,140 character limit. And then if you add a figure or a table, that's going to subtract 320 characters. And that character count does include the title. So just be cognizant as you're developing these abstracts and submitting them. And the only other stipulation around this is that if you submit an abstract, that work can't be published until after the conference. So just keep that in mind as you're kind of developing your ideas and coming up with some abstracts to submit for the conference. And I believe it's usually around December is when you're notified whether they have been accepted or rejected, or if they've been accepted for a podium presentation or a poster presentation. What else? The other thing we wanted to bring up, would having an abstract kind of workshop be helpful for this group at some point? I'm not sure if we'll be able to do it this year, but is that something the group would be interested in having some mentorship around that area? Okay. If you feel like that is something you'd be interested in, feel free to reach out to one of us or post it on ICHLT Connect if you're listening to this recording, just as a response. We're kind of just trying to identify what nursing and allied health wants and how we can better support members. And that's one idea that we've kind of been throwing around if there's interest within the group. Okay, I'm going to kick it over to Colleen now, who's going to talk about a few other things.
Yeah, and I think part of the abstract and the symposium pieces, the fact that if you haven't submitted before, we don't want that to be a barrier to you submitting. So if you feel uncomfortable or just need some guidance, that is really what the leadership team is here for. We could pair you with a mentor. We can provide feedback as a group. So even if we don't necessarily do a workshop, however, I think that would be extremely beneficial, even for me, to hear how others tackle the ideas around abstract submission. I would find it very helpful, but I think the biggest message we want to get across is if you haven't done it before, feel like you don't have the necessary experience in submitting symposium or abstracts, please don't let it be a barrier, and have reach out to us for any advice or how to go about it. And yes, I see a question from Dr. Bendon.
Yeah, thank you so much, Brittany, for the overview, and I think already highlighting, the 2025 meeting, which is great. It's very important meeting. I'm not only saying that because I will be the president of the 2025 meeting. It will be in Boston, and so there will obviously be some changes with regards to the different ways of how we would do that with regards to symposia, length of time, and early morning sunrise symposia and such. It will be a bit different than in Prague, and you will obviously get some more information as we go along. But I fully support you in that. The earlier you start thinking about it and start, like putting those things together is important. It's always very good to reach out to other, you're a very interdisciplinary group, as you've just shown. So there's heart, lung, PVD, and MCS representation in your group, but also important to reach out really to other groups. Try to make those symposia reaching and being fully interdisciplinary. That always helps for them to be, I think, successful. Don't be disappointed if they're not successful. Very often it's also just in parts. which is very important because obviously the program committee has a broad overview over the whole program and tries to put it all together. And the program chair that I selected for the 2025 meeting will be Kieran Kush. So she's an adult cardiologist from Stanford. So you have her as a North American female adult cardiologist, and then myself as a European male pediatric pulmonologist. So you see, even within our little mini team, we try to cover as much as possible. Then always remember when you pick, like people for your presentations or speakers or also chairs, that you always remember, I think she's always very important to keep the 3 G's in your mind. So which is G for geography, and G for gender, and G for generation. Always have younger people also being part of it. That's very important. And I note, obviously, except of Christiane, now I'm calling in from Germany, you have a very strong North American representation, but always remember, ISHLT is an international society, so try to have colleagues and friends from all around the world being part of it. I said she's really trying hard to get involved also, or to get those people involved that are in Australasia. Sometimes it's very difficult with regards to timing. If you just look at the phone call like this one now, I mean, our colleagues in Sydney, it's 5:30 a.m. in the morning, so it's really difficult, I think, to always get everyone at the same time. So hopefully, with the fact that we are recording this message or this meeting, we have the chance also for others to look in. But these are the important things when you start to design your symposia. And I think overall, I think this is a great idea. To, however you call it, a workshop or so, but to help each other, the more senior, more experienced people, the younger people that sometimes have brilliant ideas and think a completely different way, to also come up with ideas and getting them onto a piece of paper. And don't be afraid. Sometimes also the submission website, a lot of things you need to put in. It was much easier 10 years ago or so with just a Microsoft Word file to be submitted. But it all is part of streamlining. And of course, the meeting is large. That's why the process also starts early, exactly as Brittany says. So basically, once you depart from Prague, you're already in the middle of planning the Boston meeting. That's the fun of it, but also that's stressful at times. But I think you're a great team, and so I think you should support each other. And if there's anything what the board or the executive committee can do to help you, you need to let us know. Obviously, with Karen, you have a great board representation. I just had the pleasure last weekend to be actually in Chicago for the autumn board meeting with Karen, and I can tell you she's a very excellent representative of nursing and allied health. So, so if there's anything, also reach out to her. I'm sure she's more than happy to help you.
Great, thank you so much. We have a couple of other announcements just to run through. Similar to what we discussed earlier, the nominations committee met. There were 2 open positions within our professional community. It was the liaison to the MCS IDN, and then also the liaison to the lung failure and lung transplant IDN. So we received some great nominations for each of the positions, and that will move forward then to a vote, I believe, starting on September 22nd. So watch for that to be coming out shortly. And then also the volunteer opportunities within the committees. So that is open. It was opened last week, September 11th. You may have seen some emails, but there are a variety of positions open across pretty much every committee, I think, that ISHLT has. So if you are interested in being involved, please, please, please put your name forward. Certainly don't be discouraged if you aren't chosen. Things change all the time, and we're always looking for volunteers. So please put your name forward if this is something that you can commit your time to and would like to be more involved. Brittany, I think you were going to talk just briefly about Journal Watch.
Sure. And then for the open positions, I want to say next year, early career is going to be open. I'll be going into my last year of early career, I believe. And then I think next year it's going to be heart failure and transplant. I want to say those are the two positions that will open up next year. So just to give you a head start to think about whether you would potentially want to apply for that. And getting involved in some of these other opportunities and being able to put that on your application is really helpful. There's some of the things that we look at when reviewing applications is kind of what have you been involved in within ISHLT, but also what have you been involved in at your center or outside of ISHLT that has given you some sort of leadership experience or volunteer experience. So those are some of the things that we're looking at is your engagement both within ISHLT and outside ISHLT. So the volunteer opportunities that Colleen mentioned are really great opportunities. I think a lot of them might even just be one-year terms for you to get your feet wet in getting involved in some committee work. The other thing we wanted to talk about was Journal Watch, which you might see, I think it comes out monthly. You'll see it in your email. And just wanted to review what that is. I think the Journal Watch focuses on a certain PC every month. And what they do, there's a Journal Watch editor, and she'll identify someone from the PC to be the senior editor. And then that senior editor, I've done it last year, will identify 3 contributors. And what those contributors do is find an article that they think might be of interest to nursing and allied health, and then summarize it very quickly. What was the purpose of the study? What were the results? And what are some key takeaways? And they kind of put it in this one PowerPoint slide to create kind of this visual abstract of it. So you may see, sorry. You may see that this year that we need some volunteers for that. The editor will help mentor you through that process. We'll review the work. We'll work with you to kind of work on it. So if you see a call for that, feel free to reach out and to volunteer. You don't need prior experience. Like I said, the editor will help to mentor you through that process, but it's not presenting your own work. It's just finding an article related to either heart transplant or heart failure or lung transplant, lung failure, MCS, one of our IDNs, a paper that you feel like might be relevant to our professional community that might be of interest, and kind of creating a quick summary for someone who might not have time to go read the whole paper, or might introduce the paper to someone and then might encourage them to go and read that paper. So it's a good opportunity. It gets your name out there. It's another thing to be able to put on your CV to say, I've been involved in this. And that's kind of how you start to get your name out with an ISHLT. And then once we start to see your name, we keep pulling you onto different things. So it's just one way to get engaged and involved. And like I said, you don't need to have prior experience. And then Colleen, I think you were going to talk about JHLT Open.
Yeah, so JHLT Open, you probably have seen some announcements go through ISHLT Connect, but they are looking for ideas and suggestions around special theme issues. So meaning that, you know, quarterly or monthly or how often that they plan to put out these special issues, they are looking for topics that are of interest to the ISHLT community. So if you do have any topics or suggestions, please send them along to the JHLT Open editor team. We also would be happy to discuss within the Nursing and Allied Health Committee if there are topics that we should move forward. And that also kind of leads into what we're going to talk about next around the webinar. Potentially, if there's topics from a webinar or topics that aren't chosen to move forward for a webinar, would those be good topics to submit to JHLT Open special issue? There isn't really a timeline for submitting the topics, so as you think of them, I would definitely encourage you to submit those ideas to the editor team. And maybe pause there and see if people have any questions about anything that we went through.
Colleen, I'm so sorry that I cannot raise my hand. I can't figure out how to do it because we've outlawed Zoom at our institution. So I'm always on Teams and I can't find the raise your hand piece. So my apologies. So on the webinar, I know from program planning, there were some nursing allied health topics or just topics across the board in all IDNs and in communities that didn't get chosen, but they felt they would be good webinar topics. And I'm just wondering, how do those things, because it's ready made, how is that funneling back to you guys so that we're not having to reinvent the wheel? And I'm sure with all the submissions, that's a good thing. I think Heart got divided this year because it sounds like they needed to with all the submissions that came in this year. But I'm sure there will be the same thing happening again this year, where some of those topics, there won't be room for them, but they could make for a good webinar. And then I just wanted to say, too, bringing up the point of everybody can't join and we're all across the world and the timing is challenging, and that is definitely always the case. Sometimes just for these abstracts and things like that, one thing to think about might be like a tip sheet sort of thing that we can create that our community can access, and it can say, here are some really key points of advice. That's just a resource that they can pull up, because I do think I don't often have a lot of time to listen to some really great recordings that I want to hear. So I think time is always an issue. So that's just a thought. But the webinar thing, I just wondered if any of that funneled back to us, or if we're working on that. And then I do want to shout out too about the whole, I agree with you. I think thinking about Symposium far in advance, because when you're trying to go to, because I tried this time around and it was really challenging, because Meg and I were trying to pull something together. And so, you're using like your people that that are really good in lung to try to, and then you're going to your MCS team and your people that but then they might not know, and then they've got to go to someone else. And so by the time you get like your moderators and your backups and your speakers and your backups, it's just really a challenge. And finding people was really hard. And in the end, for this thing that we were trying to develop, we had to abandon it. So, because we just didn't have enough, we weren't sure we were getting subject matter experts. So I think it's great to start really early, so that when you go to the meeting, you already know what you want to put together, and you've got your talks even already lined up, so that you can really try to hit the pavement and find the subject matter experts, because that was a challenge for us. So.
Great, thank you so much, Angie. I think a tip sheet sounds like a perfect idea. I think that is a great suggestion. So we will definitely bring that back, and something that we can work on. Maybe Brittany has a little bit more insight into the symposium and ideas that maybe weren't chosen.
Yeah, so I think, Angie, those are all really great suggestions. I think we can definitely probably put a tip sheet together for abstracts, but also for Symposia to kind of go over those 3 Gs. What does generation mean? What does geography mean? And gender, and kind of, how to put a symposia together. I think that would be really, really helpful. And I agree with the idea of starting early. Come with your ideas to the conference, because something else we can talk about today is kind of that networking session that we had at this last conference. How did that go for people? Did people like that, or do they want something more formal? Because that could be an opportunity to have breakout sessions with people in the room. Hey, anyone who's interested in this topic, this person is thinking about developing a symposia. Why don't you guys all go over there and meet together and kind of talk about things? Because then you have everyone in one room. It's not emails going back and forth, and can kind of flesh out some of these ideas. So if you're coming to the conference, think about ideas and bring those ideas to the conference, and then we can try to help facilitate in-person networking to help identify, those talks and those speakers and the moderators, everything that Angie said, because that is challenging. And I think it takes more time than what you expect. It's not something you can develop overnight. As for the program planning committee, I think some have gone out, like some rejections have gone out, but not everything yet. So I'm not sure how much I can say. I'm serving on program planning committee this year. But there is some topics that we have talked about for developing webinars. Either we've talked about in the past, or some things that I have seen in program planning committee that I know aren't being used that I think might be relevant for nursing and allied health. So I do have access to that. And I think after October, we can start talking about that. But our webinar is scheduled for February. So we do have some time to plan. So, when those acceptance or rejections or partial inclusions come out in October, we'll have a better idea. But some of the ideas that we have been throwing around for webinar ideas are looking at palliative care and cardiothoracic transplant. That seems to be an interest among the group, having a webinar on that. We're having a webinar on women's health issues in cardiothoracic transplant. And there was some areas of that were potentially proposed that we can pull from program planning committee. Another idea that we've kind of talked about was some programs are starting to develop a patient and family advisory board. And I found that very interesting in terms of how do you develop one and how are you using one to both improve practice and how are you using it to inspire research. So I thought that was really interesting from both a clinical and a research perspective of how do you engage patients and families and understanding what issues they're encountering and how do we improve them. So those are some of the ideas that we had thought about for a webinar, but we really wanted to hear from this group about, are there topics or issues that you would really like to see that we can try to start putting together?
So I'm gathering there's a webinar quota for the year. And we're only allowed one. Is that what I'm hearing?
I'm not sure. Juliet could probably answer that.
I think I was envisioning something a little different that might allow for more engagement. And I don't know, like maybe quarterly versus, because then you can really be a little bit more, it can even be what I've seen and what I think is helpful. Like for me, I am heart and lung. So I want to hear some stuff going on in lung and I want to hear some stuff going on in heart. And maybe you can have a lot more. Sometimes I worry when we get too generic that it might not meet the needs of the community. And so if you're specifying this is the running theme in MCS right now, so what we're gonna do is we're gonna have webinars that engage all of our different, or you gave a nice breakdown of where the majority of us lie. So, you know, what our backgrounds are and what we're working in. So I think that is such a nice tool to look at that and say, okay, well, these are the areas where we should really we're going to do a quarterly webinar and we're going to focus on these 4 areas because this is where most of our community lies. Is just a thought, but I didn't realize we only got 1. So that may be, or we have 3.
Have 3. Juliet just said up to 3.
That's
so
good.
we have 1 plan. We have to have a minimum of 1, and we do have 1 plan for February. But it sounds like we can have 2 additional ones if we've come up with multiple ideas that people want to see. We can definitely do that.
Okay, and then I would just recommend at some point before the meeting, and it doesn't have to be a meeting, it can be just an email or whatever, but if you've got, if you're hearing and we have topics prior to the meeting that we want to develop into Symposia, then we should put it out so everybody starts brainstorming and thinking about that so that when we're at the meeting, it's like, oh, I heard about that. I really want to be involved in that, and we'll get more interest. Because yeah, I think the organic thing is great. I just don't know that it's always well organized. And I think that's what ends up happening in the end is that we're not able to dot every I and cross every T to really put forward something that's, you know, all inclusive and going to get us what we want. So.
Do you think the best way to do that would be to put out an ISHLT Connect post or have them email us individually? Like how, any ideas about how we can kind of gather people's interest so that we can start facilitating that networking?
Yeah, I think that is a good idea to do a post, but I think put in there, please feel free to email me individually or email the group, whatever is your preference. I think some people don't reply to that because they don't want to put themselves out there. Sometimes I'll see Meg post something and I just am like, oh, I loved reading this. That was a great idea. Just because I want her to know that people are getting what she's putting out there and that there is somebody out there on the other end. But I think sometimes people are nervous about that. So if they feel comfortable just replying to you with their thoughts or whatever, but I think posts help to generate, you know, ideas.
And maybe we can even develop kind of, if we don't get many ideas, responses, maybe we can start to develop very broad topics so people can start to break out. And then within those groups, maybe they can focus a little bit more.
Yes, but I would maybe think about mentors in the areas that you're talking about, where you, like when you did your breakdown and it's like, okay, this is where the majority of us are. If we've decided on 4 areas that we're going to hit, or 5, then say, these are the mentors that are really, and you can throw out a couple people, but these are the 2 MCS people to reach out to if you want to develop this particular topic, or these are the heart people, the lung people. I think that might help as well, because then they can just email those individuals. It's just a thought. I don't know.
Great. Any other thoughts?
Yeah, I think we are really trying to work on transparency of, who to go to. I think with the restructuring, I think people are still trying to get a sense of how everyone fits in, and really what your resources are. So I think those are great, and kind of calling out certain representatives or liaisons or committee members in where and how to contact them. So great suggestions.
I have a quick question, and maybe Greg or Juliet can tell me this. Do you know when the next Nursing and Allied Health Academy is going to be? I know they were kind of alternating years.
We don't have that schedule yet. The entire academy, the approach to the academies is being reshuffled a little bit to align better with the new organizational structure. Although acknowledging that nursing allied health is an outlier, and it's not heart lung, it's a different group. I expect that we will have that before we get to Prague for that meeting. We'll have a more of a plan and be able to look at how that lays out over several years.
No, that's great, because I was just after I was at the board meeting, I ended up going to the TMG administrators workshop, and we were all talking about all the new nurses coming into our field. And, before, we were definitely not necessarily hiring people that were not experienced either in ICU or had a little bit of cardiac, but now we're hiring, anyone that's, interested in our positions. And so it seems like if we had something educational at the next, whatever we do, for coordinators for heart and lung transplant, MCS, I know, and Colleen, you could probably speak to this. MCS has an amazing group of really engaged nurses that have academies and have a lot of the ICAC and so forth. But for transplant, it's a little bit more difficult for us. And so I know I'm kind of on this soapbox for the past couple of years about trying to have something, more educational for our group, to bring in new coordinators and be able to educate them. But anyway, that's just my thoughts.
Noted. Thank you.
I think if for some reason we don't have a Nursing and Allied Health Academy for 2025, maybe we can start thinking about that for Symposia, because I have heard that at the last meeting from some nurses where they felt like they wanted to go to a session that talked about their practice and how, like, professional development and training. And I think Angie has talked about kind of that clinical ladder. So that might, if we can't get an academy, that might appeal to Nursing and Allied Health, but also Early Career and Trainee Committee as a combined focus area. Or even if it's not just nursing, maybe, Nursing and Allied Health, or we could further think about that. If for some reason an academy, there's not a spot for that, thinking about trying to develop a Symposia around that.
Can I ask a related question? Thinking about an academy, and those typically precede the ISHLT annual meeting by a day. And I have heard anecdotally that it is difficult for nursing allied health people to get that extra day, right? Because it's travel, it's time out. Would it be better to hold that as a standalone event in, a 1 day or a day and a half event in a city somewhere? Or is there another meeting that we could abut up next, hold the academy next to, that might be better?
Karen, what do you think about ICNS and collaborating and doing it that way? Because it is an international meeting. I don't know.
Yeah, Greg and I
That's the
just
only
talked
way
about
I
that.
could think of it, but
Yeah, I think ICNS is a great idea. I really do think we would bring in a lot of people, and I could be wrong, but I just think that our profession needs that right now, and we're going to definitely need it in a few years from now. It's not going to get any better as far as the nursing shortage, at least where I've been in California, and here in Texas and Austin, we're having a really hard time. So I think, whatever we can do to bring in the interest and see the great things that we can do, in transplantation, I think would be so awesome.
Thank you.
Looks like, I think that's Kate or Catherine has her hand raised.
Kate, yes. I was just going to say, this would be something that I feel would be incredibly well received from the standpoint I'm looking at. We were a new advanced practice team for lung transplant at Vanderbilt 3 years ago on the inpatient side. And we really struggled to kind of get a grounding on how, even as from advanced practice, to make the team work. There was just nothing at the institution. And so we were kind of trying to find other ways. How did other advanced practice teams do lung transplant? And, we have a great heart transplant team here. So we did pull from them, but as we all know, they're not identical and they function exactly the same. And now we've grown so much that we're struggling keeping up with, on the coordinator side, getting people with backgrounds in it and needing more and expanding or hitting those things would be vastly helpful for new growth or growing programs to help educate their teams.
Definitely.
Maybe this in the interim could even be an additional webinar that we propose, and maybe not even webinar, but maybe some discussion in the beginning, like some formal kind of discussion in the beginning, followed by more of a discussion of kind of practices and learning from each other instead of waiting 2 years for it. But we could at least maybe get it started, and that might help kind of propose some ideas for an academy or future symposia, because it sounds like people are interested in this topic.
Yeah, I think that's a good idea, Brittany, because I know I tried to put together a nurse practitioner symposia, but it was so centered on just APPs that, of course, being in the program committee, it's hard to say, okay, yeah, let's have one all on APPs. But for something for us, yes, I think we could do something like that. You could have an APP webinar, you could have a nurse coordinator, RN webinar, and really, I just really think we'd have a good interest in it.
I just wonder at the meeting too, instead of we could develop formal symposia, but there's also these early sunrise sessions that we have that are focused on early career. Is there any opportunity to have some reserved space, just to reserve a room to kind of, instead of it being a formal symposia that, for lung right now, we're looking at filling 11 spots. And I think it's hard to make one just focused on nursing to take up one of those 11 spots. So is there any way of building that into the conference moving forward, where it could just reserve a room for us to have kind of this add-on, even if it's early in the morning? I'm just trying to think about how not to make it so formal that we're not competing with, these other research and clinical interests.
I will check into that. Early morning would be the possibility, because we don't want to schedule against sessions. The space in Prague is really tight. Otherwise, typically we'd be able to say yes right away. I will check into that and let you know.
Well, I'm not sure the nursing attendance in Prague is probably going to be very high.
Right.
Just historically, it is harder.
Right.
Boston would be a good, probably
right.
good place.
Boston. Mm-hmm. That we can do.
I think, Angela, as you just mentioned, the financial issues, I think it's not yet out, but there will be obviously travel grants coming for the attendance of Prague meeting. So I think it's very important that you guys watch out for that once it's, those are going out. And I think we put some extra money in, we take some extra money in our hands to really make it possible for various people to attend. And then obviously always remember, you might get more support also from your own organization if you put in a research abstract. So really encouraging, people within your field, to submit a research abstract by the deadline that Brittany already mentioned. I think it's the 17th of October, if I'm not mistaken. And that also will help you, but there will definitely be travel grants, there will be more. And so enabling all of you guys to also, or many of you also to attend. That's obviously our aim. And I think maybe Greg can just give some more details, but what we're trying to do also, last year when I was so lucky to attend your PC meeting, which I felt was great. It was a nice atmosphere, but there's some new ideas around how we can actually, attract more people. I think someone like Brittany mentioned before that there's still some unfamiliarities with the new structure, even though it's now in place for some time. But with that kind of, like revitalizing and changing with these PC meetings, we're trying to obviously attract more people to the PCs. I'm not sure, Greg, if you want to just give some brief details.
There will be professional community meetings in Prague, and we're taking it a step beyond where we were in Denver, where it was just a socially focused event. And the feedback was, there should be some time also for more formal presentations and discussions. And so we are going to build that in so that it's part social and part business, because that, it really is the centerpiece of the year in many ways. And I understand it's going to be difficult for the nursing allied health people to participate in the same kinds of numbers outside of North America as inside North America, but we will do whatever we can. As Chris mentioned, there will be additional travel support money in the budget this year so that we can provide as much support as possible.
There's one other thing, just looking at the watch, but what I think I want to really let you know is obviously this meeting, this is an international meeting, this is a Zoom meeting, so everyone can link in for no money, but because of timing issues, it's difficult. But also you see that, you had more than, how many, 200, you said, people in your constituency, and now we're about a dozen or so. So the question is also that what we are thinking about at the executive committee last weekend in Chicago is how we could increase participation. We were thinking about really selectively inviting certain people by email to attend these meetings and really RSVP, them so that they really have a personal invitation. I know you can have this town hall format for everyone to call in, but then very often people say, oh, I'm so busy on. So maybe if you get a personal invitation and we select certain people that we feel they are, current or also future leaders in the field that we would like to have more involved, then that will be an opportunity for them getting a personal invitation and then to RSVP if they've got time to participate, and making it a bit more formal and a bit more personal and individualized as well. I don't know if you want to add anything to that, Greg.
No, that's the plan as we evolve these town halls in particular. It's it's difficult for someone to carve an hour out of their schedule for something without a specific agenda. And so I really appreciate everybody's time, but that's something that we're going to work on in the next iteration of these town halls. And we're also talking about making them 30 minutes instead of 1 hour, which would be easier for people to jump in with a very focused agenda that will be designed to engage those up and comers in the society, because that's the thing that we hear most often is, how do I get more involved? And so we will identify people who should be more involved and send them invitations to make sure that they know that they're welcome and that there's a purpose.
One other idea that I just had, we talked about how we might not have as much representation for nursing and allied health at Prague, but we are planning an in-person PC networking event, and it might be more formal in the beginning. Is there a way to live stream the beginning of that so people who can't attend in Prague could join via Zoom, listen live, and at least engage in that part and feel like they're part of the meeting in that sense?
I will check.
It's a great idea.
Yeah. And since that meeting would be early evening in Prague, in North America, it will be afternoon.
Yeah.
It's kind of interesting, Greg, that you just mentioned before, we want to make these future town hall meetings, you know, brief 30 minutes. But then when I look at the time now, we've actually spent an hour, and we only, I think, initially waited for, I don't know, 3 or 4 minutes, you know, for everyone to actually be on the meeting. And I think we've not talked about, you know, our holidays and whatnot. We've really talked business, and it was very, for me at least, very insightful. So I really want to thank you for allowing me to be here, and that was really great. I've learned a lot, and you know, a lot of things I can talk to Greg and the rest of the executive committee about. So definitely worth, you know, to spend my evening hour with you. Thank you so much.
Thank you, everyone. I want to just throw one more thing out, because I really am firmly a believer in this mentorship thing, that I'm not thinking that I don't feel like we've carved it out the way we need to. So when you're talking about the meetings going forward or what have you, I think, I mean, I'm on here to try to offer what I can, but I think it's good to maybe pinpoint, in addition to the new people that you want to bring in, pinpoint all the different areas, a couple of people to participate as mentors and to keep the conversation going and to help with that process. So, you know, we should have lung transplant representation, heart transplant, MCS, advanced practice, all the things that are on your survey represented. And maybe just, it doesn't have to be super formal, it can be informal, but just call out to a couple of people and say, hey, I just want to make sure that you're going to be on here on this meeting to speak for MCS, or just to be in the background and represent. So I just, like pediatrics, like just making sure that we have everything covered for our meetings to help engage people who might come on. So just a thought.
Great thought.
Yeah, that's a great idea. People don't know who to reach out to, and kind of identifying that person for them would be helpful. Juliet, do you know anything? We have expert link, but I had heard that that might be restructured, because that was an opportunity to try to connect mentors in different areas. But I heard that was going to be restructured. Do we know anything about that? Or Greg, maybe?
No updates, but maybe Greg may have an update.
Yeah, it will be restructured. We had about 140 people sign up to serve as mentors, and then nobody signed up to be a mentee. It was one of those ideas that it's something we need in concept, but in practice it didn't play out the way that we had hoped. So we're going to reinvent it. We want to definitely take advantage of those people who have stepped forward and said, I can help, and give them a role. But we have to find a different way to make those connections. And I think that, you know, what Angie was suggesting, where we have representatives who are invited to participate live in these calls, in these kinds of town hall meetings. And then we also invite early career people, up and coming people, people who have just been identified as, you know, someone who should be a part of this. And we kind of we're more proactive about making those kinds of connections. People just weren't interested in the online version.
I know we're out of time, but I just wanted to bring up one more idea that I just thought of. At the last meeting for early career and trainee, we did our first kind of networking session where we identified mentors to cover different topics, whether it was clinical or whether it was research, or we kind of identified all these different areas and had a mentor at each standing table. And each of those tables had questions that we developed ahead of time in case, someone walked up and didn't really know what to say. They could pick up a question and ask the mentor sitting at that table or standing at that table. We had wine during the session, and it was like, I think it sold out. It was really successful. And I just wonder if maybe we could do something like that for our networking session, where we had something more formal and then had these kind of high standing tables where we had a mentor standing at each table and kind of representing a specific topic where people could just walk up and start engaging. Because it's kind of like that built in, you're supposed to walk up to me and ask me questions, not the awkward, like you have to build up the courage to do so.
Right.
So I feel like that, Angie might help some of the issues that you've raised around identifying specific mentors for specific topics and doing that kind of in person as a way to facilitate networking.
Yeah, I think that's an excellent idea. And I was at that and I think it was very successful.
Yeah.
And I am not really, I agree with Greg. I think the online thing is hard, I think, to make happen when you don't know someone. So I think this more organic thing of just having newer people at these sessions, but with people, experienced people also involved, it'll happen in a different kind of way, maybe just a more natural, organic way. And then people just haven't begin to develop a network to reach out to. But I think we're going to have to tag people to, do these things, or it's just probably not going to happen. So, or we're all going to, the same people keep staring at each other. So, it's going to have to, I think we're going to have to tag people.
Yes.
Real quick, I was just going to maybe add on your next survey what might be helpful. And if there's some way to do this, please let me know. I'm not great at navigating all of ISHLT yet, but knowing who might be also at our facilities. I know within my facility, I assume a lot of people are ISHLT members for different reasons. But we focus so much on our facility research, our facility committees that we're doing, and not necessarily always reaching out onto the ISHLT side of things. And so maybe if there was somewhere where I could look up what other advanced practice people are involved or mentor, and what they do if they're part of ISHLT and different things within or close to my facility, that might also help. I could go to them locally. So that might be something to add.
So there is ISHLT Connect. I'm looking at the directory now to see if you can filter by, so you can't filter by center.
Right.
You might be able to put city in though, but some people use their home address versus their institution. So I don't know if that's something we can work on to filter by center. So you could just type in center and see who's an ISHLT member at your center.
I will check into that.
Creating a long list for you, Greg. Sorry.
Yeah, I know. well, these are all right now. It's just a lot of I will check into that. So some of it, but this is how we move it forward, right? Some of these things will be possible, and some will not. But they're all good ideas, and it's all helpful in sort of understanding the bigger picture of the kinds of things that we can do to help people.
Yeah, I think that's a great suggestion. Thanks, Kate.
Yeah, for sure.
Okay, well, we're over on time. If there's any other last minute comments, feel free. Otherwise, I think this was a great session. Thanks for joining, and thanks for who are listening to the recording. Take a look out for future webinar and topics, and maybe we'll post something on ISHLT Connect if you have some ideas. And again, feel free to reach out to us individually if you don't want to respond to all, and we can kind of compile those ideas and come up with something. Go ahead, Angie.
Okay, one more quick thing, because I was on a call like this and it worked really well. And I liked this idea, but if you have a particular topic, this was centering around call teams, donor call teams, for instance, and development of good donor call teams. But it was really great because the organizer involved a bunch of different centers. And so we each just gave like very quick presentations, 5 minutes, on how we developed our call team, how it was working, what were some of the pitfalls. It was like 5 slides. It was great, but you got to hear from a lot of different centers on how they're handling that problem. So I would like to throw that out as another thing, because I think we all are handling or dealing with the same issues a lot of times. And then we can target, Like during COVID, there were some international lines crossed even for some of the things that we were talking about and some of the centers that I was discussing certain issues with from our side of things. So I think if there is a topic, that's another way to involve people is you can reach out to different centers from everywhere and say, how did you guys handle this? Or can you do a little rundown, and it can get more engagement. So just another thought.
It's a great idea. Okay, sounds good. We have some plans moving forward. Well, thank you, everyone.